my plan was just to go through the whole procedure.
Yeah, because that's what I was telling Kelly. If you had the time, just to walk me through it.
Absolutely. Yeah, that makes it easier. I mean, I like for everybody to be on the same page, make sure there's not questions. So I'll give you the quick overview, and then I'll go back. I'll run through it a second time with a lot of detail.
All right.
So we've got you set up for a double All-on-4. Based on what I've got on my plan here on your CT scan, I'm looking at probably 6 implants up top, at least 4 on the bottom, maybe 5, maybe 6. So when this procedure first started, it was, they coined a phrase called All-on-4, which is what most people, kind of knew it to be. Now it's shifted a little bit. Now it's what we would call more of an all-on-X, because X is the variable, how many implants. So in your case, probably be, at least 10, maybe 12. My goal is always to over-engineer cases. More is always better.
Right.
More can sometimes mean it's a little more complicated from our perspective, but main thing we want is for you to have a successful result and have a happy patient.
Right.
That's it.
That's what I want.
And for things to last for a really long time.
Yeah.
So that's basically our philosophy. So in a quick version, what will happen? We've taken you already through the diagnostic records. Mm-hmm. So in that process, we did the X-rays, we did the intraoral scans, we did photographs, face scans, all that data that we need to put into our software and build everything we need for your case. So that's building the surgical guides, which are a really important part of the process, the prosthetic teeth that will go in the day of surgery, and then all of our mapping that we need to guide that surgery. So once the records are done, that's the first visit that you'll go through, is the diagnostic records. You've already done that. We've already done your case planning. Actually, we get on the computer and go through the software modules to plan your case. Production on all the parts and pieces happens next. So we produce a surgical guide, we produce a teeth, we order the implants. I am big on only using quality parts. So the implants that we use are made in America. High quality surgical grade titanium, same type of titanium that's used for orthopedic surgery, like hips, knees, anytime they put a screw.
Got one right here.
Yeah, screw in a same kind of thing. Really good stuff. The prosthetic teeth that we make those here in our lab, and those are typically made from zirconium, which is kind of the industry gold standard now. The materials we use either come from Germany or Japan. Just good products that we use for a long, long time. And we've got all the machines, CNCs, printers, everything that we need here in the lab, along with our 2 lab guys in the factory. So it's a very controlled workflow in our office.
Right.
We've been doing this going on about 10 years. These actual procedures, the full arch restorations with implants, a lot has changed in that time, and we've really grown and evolved our process during those last 10 years. We took the time during COVID to build out our own laboratory.
Yeah, I think I remember you
So we put in all of our own equipment. I've got 2 guys that work back there full time, just making teeth. They do an incredible job with it. So I'll make sure we show you some examples. We probably looked at some last time you were here.
I haven't seen any.
Okay, I'll get them to pull one out when we get finished today and take a look at it.
Yeah.
Okay, so once we get through records phase, building out your case, we have your surgery schedule. So you would have gone to see your doctor, or maybe you
went today.
Went today, good.
He's emailing it over.
Great.
The form.
Great. So we get your medical clearance, that goes to the anesthesiologist. Surgery scheduled, so your next visit would be for surgery.
Right.
We usually do those in the mornings. We start pretty early, 7 or 8.
How long is that? How long is the procedure?
For your case,
Just ballpark.
Yeah, doing a double arch is usually about 3 to 4 hours. A lot of variables that can make it faster or slower.
Right. No, I get it. Yeah.
Yours looks to be pretty straightforward. I mean, we've got planned on your scan. We can see bone densities look good. You've got enough volume of bone. We're looking at height and width and density. to make sure that we've got room for some substantial implants. Implants come in different sizes, kind of like wood screws would.
Yeah, right.
So if we went to Lowe's or Home Depot and picked out some wood screws and we said we really want this deck to hold up well,
Yeah, right.
get some really long lag screws, wider the better. So same kind of deal with implants, but you've got some good substantial bone, so I don't foresee any concerns with soft bone or anything like that. Yeah, it's good. So the day of surgery, you'll come in, we'll put you to sleep. Anesthesiologist will be here. Dr. Atwood, you've met with him or talked with him. He'll be here to put you to sleep. We'll get started on the procedure. We'll get all the teeth out of the way. So you only have, looks like about 6 natural teeth remaining. We'll install our surgical guides, do everything we need to get the implants placed, sew everything up, get the teeth fitted, wake you up, send you home.
Now this first set is a temporary set.
The first set that you receive is a temporary set.
Right.
And that is a set that we will manufacture here. They're typically 3D printed. They're made from the designs that we've created during the planning phase. And they're already set to fit the implants prior to the surgery. So
are they gonna look like what the originals are gonna look like?
They will look very much like what your permanents or your finals would look like. I can show you some examples of those too. It'd probably be helpful. The printed resins look a little different than the zirconium, but everything is hand finished. So the guys in the back have an artist brush and some different colors, so they're applying colors to the teeth and colors to the gum that make them look natural.
Yeah.
We're big on natural looking results. Our lab is called the Natural Smile Dental Lab. That's really because that's what people want. You don't want a set of teeth that somebody's going to walk up to you at church or at the grocery store and say, "Ooh, Chuck, some new dentures."
What's up, dude?
Right.
Yeah.
The white chiclets. That's a no-no.
This is all. I mean, I hate I have all the questions, but
I don't.
I mean, my whole life since I went through this windshield with this wreck and had teeth knocked out and glass and everything messed up. That's all I've known.
Right.
This
will be life-changing.
I'm done.
I mean, you're going to feel like you did when you were 16 and you didn't know any different.
That's when it happened.
Was it? Yeah.
So that's how long it's been.
Yeah. It's a big transformation. It's really not a difficult adjustment to go through. Most people get used to it pretty fast, recover from surgery pretty quickly within, week to 10 days, something like that. Sometimes you'll have a little bit of facial swelling, sometimes some bruising, in your face and down your neck. All normal, all things that are, recover pretty quickly.
So these I'll keep for 3 months?
The temporary set you'll have in for about 3 months. And that's the reason that we have that 3-month window is that we're waiting on the body to integrate the implant. So we're, just like if you broke your arm and went to the hospital and they set it, we're waiting for that bone to grow back. So the bone has to grow and infuse to the implant. So once that process is complete, and that's not something that we can easily rush in the body, it's just going to do its own thing. Then at the 3-month interval, you'll come back and we'll start the process of converting you over to your final set. And that's usually a series of about 3 or 4 appointments. We go through some of the similar records from the initial phase where we would take the face scan and the intraoral scan, another CT scan. All that data goes back into the software so that we can see, where are you currently. We locate all the implants within the software.
So that's where you make all your adjustments.
We make all the adjustments. So if, let's say you came in and your temporary set, you said, hey, I'd like to have them a little bit longer. I want to see the teeth look a little bigger, or can you shift them this way or that way? Little small things that make them look like they're a part of you. We record all that. We've got multiple people looking at it. So the assistants are looking, my lab guys are looking, I'm taking a look at it, you're looking at it. So we get all the opinions in for what we feel like we need to see. And You know, the most important one is yours, of course. You know, you get to tell us, hey, this is how I want my teeth. But we won't let you make a bad decision. The goal is that when they're done, it just makes you look like a new version of yourself. Not, you know, they're not going to look false. They're not going to look like dentures. And you get to pick the color.
Yeah.
So let's see. We've finished that conversion to final. So once we wrap up and get the final set, we've made all the changes you need. Those get installed. They are installed with little tiny set screws. So there's a series of little screws that screw the teeth onto each implant. Right. Those get torqued in, just like we would use a torque wrench in auto mechanics. We have to set the torque according to the manufacturer's specifications, and then we seal those access holes up and send you on your way. You'll come back in about 2 weeks for a check, an adjustment. We're just checking the bite, making sure everything feels good when you eat, not having any issues with anything rubbing or anything that feels...
This is with the permanent set?
That's with the permanent set.
Okay.
And it's with the initial set as well.
Right.
There's going to be check steps all along the way to make sure that you're comfortable not having anything that's bothering you or giving you trouble. Once you're finished, we usually like to have you come back twice a year for a cleaning and a check. Just like getting your teeth cleaned normally, hygienist is going around there blowing off any debris and black and tartar, cleaning things up, polishing them. About once every 2 years, if we feel like we need to, we'll take them out so that we can check and make sure everything looks good underneath. Parts we can't see, we'll check the torque on all the abutments, and that's the piece that's attached from the implant to the teeth. And then we'll put in a new set of screws. And that's just kind of normal service. That's like going in to get your oil change or your brakes done, just make sure everything's running well.
Yeah. So they never, I guess what's the word? They never attach to your gum.
They are resting on the gum. So the implant itself is sitting down in the bone, like we see here.
Right.
And then on top of the implant is an abutment. So the abutments look like a little teepee or a little pyramid. It's just a circular conical form, so that screws into the implant on one side and into the teeth on the other side. So it's an interface between the implant and the teeth, but then the teeth are built to just rest on the gum with a little bit of pressure.
So it's kind of like a bushing.
Yeah.
I guess that's what I'm thinking.
Yeah, exactly. Except it's
not really.
It's made of stainless steel. It's
Yeah.
not necessarily like a bushing, because it's not absorbing, shock or pressure.
Right.
It's rigid. The gums are probably more like your bushing or the gasket. We're having the teeth engage the gums with a little bit of pressure to try to create some seal.
Mm-hmm.
It's not going to be an impervious seal.
I guess that was the word. Seal. Yeah.
You won't get it's not going to 100% keep food or liquids or anything from going underneath the teeth. So you still have to go in and clean. You still have to use a little floss pick to go under them. It's just near impossible to make them such that,
right,
because the gums have such
so
flexibility.
I guess I don't have to, or do I have to worry about something getting between the gum and the...
I wouldn't call it a worry. I mean, it's stuff gets in between your teeth now and you, right?
Yeah.
It's, if something creates pain, like, hey, I've got something stuck, and you'll feel it.
Yeah.
It will help you learn what the normal cleaning routine needs to be, because you clean them a little differently than you do natural teeth.
Right.
But first time you see the hygienist, she'll go over all the tools you need. It's basically a power toothbrush like a Sonicare, a water pick, and then some little floss picks, which is just a little small brush, almost like a toothpick with some little bristles on it that you can go in between the teeth and the gums.
Yeah, I think my thing wasn't necessarily between the teeth, but from the gum to the
right
where they sit.
Exactly, and that's really the place that you have to clean, because the
Is that
teeth
where the water
themselves
pick comes
are
in?
one. That's where the water pick comes
Okay.
in. The teeth themselves are just one long horseshoe.
Gotcha.
And I'll get Karen to get one from the lab and show it to you because it's helpful. You see if they can grab you the one I was looking at this morning. We were getting ready to deliver for the bottom arch. It'd be good to see it.
Yeah. Okay.
This is probably since I finished, we talked about this probably the other day, since I finished school in '96, this is the most advanced thing that has come along. There's a set, just so you can see, this is a set we were getting ready for another gentleman who's coming in, I think later this week, but you can see how natural they look.
Right.
And you can hold them. You want to feel them?
Well, they got some weight. These suckers are heavy.
You feel it initially just a little bit, but then once they're in, you don't. Physically, this is on par with steel. So it's a zirconium, and then you can see here, this is where it sits on each individual implant.
Right.
And then the set screws come through the top. So it's a little screw that's about 5 millimeters long by about 2 millimeters wide. And once these suckers are in, they're in. The only things you may find that you have to deal with down the road is once in a while we'll see somebody show up and they say, something's loose. Well, that just means that one of the screws has loosened up a little bit. We just open that up, go back in and tighten it right back.
Send it back.
We can. It's a little risky to put some Loctite on it, but I've had somebody ask me to do it, and I did. And
Well, I don't think I'd get that far.
it works. I think I trust the way I've been doing this for a long, long time.
Yeah.
And, you know, you get a recipe for how you know things work, and when you use high quality parts, like when you know that the manufacturer specs on these screws are what they're supposed to be, and not, oh, I've got some cheapo screw that really doesn't thread in correctly, it makes a huge difference.
I think the hardest thing for me to visualize is, you know, your tooth is right to the gum, but then you got gum on top of gum.
Right.
It just seems like they would, you know what I'm saying? Does that make sense?
It does, and you know, everybody takes a minute to get used to it. But it's generally not a long process. We generally don't see patients that have major concerns that, hey, these, you know, everybody says within about 2 to 3 weeks they feel natural. They feel like a part of them.
Yeah.
It's different, you know, because it's one solid piece versus 12 or 14 individual teeth.
Well, I think I was just thinking, like, it just seems like a lot of gum.
Well,
Gum on top of gum.
this one is, and this one's different. It really varies based on your anatomy, the size of your jaws, how big your mouth is. So this one probably looks like more gum. Most of them, for most patients, you're probably going to see something like that.
Okay, that makes sense.
Yeah, this was just a kind of a big guy, and he'd lost a bunch of teeth. Right. Was that a provisional set? Okay. Oh, yeah, with less gum. Do you have a provisional set? Here's one that may help you to see. That's one with a little less gum, and that's zirconium as well. There's another one.
Yeah,
this is probably that's probably kind of an extreme example.
Yeah.
Probably not the best one to show you. What do you got? Provisional set?
Yes.
Yeah, so here's a provisional set. And you can see holes are a little bit larger for access during this set, but that's all made from a printed material. And then the gum color is hand applied, finished. So they look real natural.
Yeah, they do, and that's a huge difference in those two gums.
Well, sorry, I didn't mean to scare you with that first one.
I was just having a hard time visualizing, you know what I mean?
Yeah. What other questions can I answer for you?
Gosh, Gosh, I don't know. I guess, I mean, as far as eating, I'm on strictly liquid, protein shakes and broth.
Yeah, so during the first 3 months after the surgery is completed and we put the provisionals in, you are on a little bit of a restricted diet. Softer foods, not anything that's super restrictive, but things like pasta and fish and mashed potatoes, vegetables that are cooked well, not ribs and tacos and corn chips and things that are harder, that require more force to chew is what we're trying to
avoid. So basically, if you can swallow without chewing, that's the kind of food to eat.
And you can chew a little bit more, but it's a little bit of an adjustment, but it's only for that 3 months, and then you can go back to eating whatever the heck you want to.
So as far as after the surgery, what am I to expect as far as, I know the swelling, bruising, but as far as pain and, I mean, I know I'm going to have it. I just I want to know, okay, well, this is expected.
Right. After surgery, what we would typically expect is you're going to have a little bit of swelling.
All right.
You're going to have some discomfort. Usually it's mild to moderate discomfort. Something that you would manage with a combination of over-the-counter pain meds like Advil or Tylenol, and during the first 3 to 7 days, you might need something like a prescription pain medicine. We set all that up for you in advance, but most people report, hey, I had a little bit of swelling. Everybody's a little bit different as far as how much they swell. Swelling will reach its maximum by about day 3, and then it will start to recede. Some people bruise. Some people bruise a little bit. Some people bruise a lot. Caucasians tend to bruise a little more than other races. You can sometimes have swelling in your lips because we're having to stretch things a little bit to get in there and get all the work done. Occasionally we'll see patients where their lips will get a little bit swollen. Put some Vaseline, some Carmex, something on them, and everything recedes. It's rare that we would see someone that reports, I'm having major pain after this procedure.
Like throbbing.
Yeah, actually quite the opposite. Sometimes, and it's typically with patients, would say as the body ages, sometimes it experiences less pain.
So what do you say? No, I'm kidding.
Well, I would say the category of patients that I treat that will report the least pain are generally older males.
Hell, that's because everything's worn out.
You got to stay used to it.
It's worn out. It's not firm anymore. It's soft.
So some people say, hey, I took pain medicine the night of the procedure and I took some the next day and that was it.
Yeah.
We can generally gauge a little bit better right after the surgery.
Yeah.
But it's not that you need to be geared up for some major rigorous week of pain management and suffering. It's okay, you're gonna lay up in the bed and relax a little bit, take some medicine, eat some soup, some ice cream. Hopefully somebody's there to help take care of you a little bit, give you a little bit of TLC, but within a few days, you're up and around and doing what you want to.
Okay. Sounds like a plan. You cleared up a bunch.
Okay. And if there's any other questions, call us, let us know.
I will.
Main thing,
I think I just wanted to get the gist of what's going on.
And all this will come back to you in writing as well. Prior to the procedure, there's a whole list of, the instructions, what to expect, what to do, what not to do.
Yeah.
And then you have constant contact with someone from the office. Usually we have one of the assistants from the surgery that's assigned to be your contact person. So they've got a phone number, you can text them, you can call them.
That's good.
Whatever you need. I never want patients to feel like they can't reach us, and I never want you to feel like, oh, this isn't something I want to bother them with. There's no stupid questions, and there's no time that you should feel like, hey, I shouldn't call them.
Right.
I mean, this is a big deal.
Well, that's
you
good
know,
to know.
it's-
Yeah, that's
yeah.
huge. Yeah.
You made a huge commitment
Yeah.
to do this, and we want to be committed to you on the other side of that. You know, it's a two-way street, and we take it very seriously. You know, how we do it and our process and our service. The whole deal is it's the whole experience. It's not just what we do to fix your teeth.
Right.
Right.
Sounds good.
Okay, man.
Sounds impressive.
Good. Well, we'll absolutely deliver for you,
I'm
and
sure you would.
keep you posted. Everything was okay with your physical?
Yeah.
Okay.
He's just gonna send it over.
Very good.
I was telling Kelly, I thought he was just gonna fill it out and say, here, take it back. But the waiting room was packed with people, so I wasn't gonna block him. I had my 30 minutes with him, so
It's a lot.
move on to somebody else. Yeah. But yeah, he'll get it over here now.
Okay. Perfect.
All right.
Okay, Chuck.
Good deal. Man, appreciate you.
Yeah.